The broadcast is now starting. All attendees are in listen-only mode.
Good morning. This is Michelle Smith with Texas Action for Healthy Kids. We welcome you to our webinar this morning, Partnership for School Health, looking at the whole school, whole community, whole child. This is being brought to you by our Action for Healthy Kids partnership between the Department of State Health Services, Texas Department of Agriculture, and Texas Education Agency. These webinars have been going on for several years, and all three of the state agencies work with Texas Action for Healthy Kids to try to help schools expand their knowledge and resources around coordinated school health and the whole child concept. Excuse me. This morning we will be recording this, so if for some reason you aren't able to stay for the entire webinar, it will be posted. You obviously should know that you can use either your computer speakers or your phone, and all attendees are muted. If you have questions, you can enter those during the presentation, and we will answer those questions at the end, or if it's appropriate, we might answer them while our speakers are presenting. The links and the slides will be sent after, and actually I'm going to probably upload them. There's now an option to upload handouts, so I will probably upload the PowerPoint. That way you won't have issues with trying to get it through your system. Sometimes the files are too large. And there will be a follow-up with any links or any other additional information. So I'm going to turn this over to Anita Wheeler with the Department of State Health Services, and she is going to present and introduce our other speakers. Anita.
Thank you, Michelle. First of all, I'd like to thank Texas Action for Healthy Kids for being an ongoing partner in assisting school districts by providing timely information. As you can see by this first slide, there's a model that really has come about within the last few years by combining the coordinated school health model that the Center for Disease Control put out, as well as some work by ASCD. And so as we look at the complexity of the 21st century, and we look at all the different things that children are having to deal with in our society and in their communities, the model really begins to put the child in the center of everything that we're doing, both within the school and as a community, to support students. Next slide, please. As I said before, the whole school, whole community, whole child model is actually a collaborative approach to learning and health. We all know that learning and health go together, and that there has to be a combined effort between the healthcare system and the health support systems and education in order to really reach out to students in this very complex world that we now live in. Next slide, please. Now in Texas, this is the coordinated school health approach that we're all very familiar with. You've got the 8 components. This was developed and been in the United States since 1987. It was promulgated by the U.S. Centers for Disease Control, and it really is a model that provides succinct and distinct framework for organizing a comprehensive approach to school health. Again, our state requirement, we have 4 components that are required within a coordinated school health program, with consideration of the other 4 components. And so in looking at this is what we're more commonly used to seeing when we talk about school health. Next slide, please. In supporting students, we know that when students are healthy and they feel safe, when they're engaged, when they feel supported, and when they're challenged, this leads to their success. And health and education impact individuals, society, and the economy. To have all these things come together as the center of what the whole child approach is really helps all of us understand that each one of us takes a part in being a support to the students within the school. Approximately 95% of all U.S. children or youth attend schools, so schools really are the optimum place to really combine health and education. Next slide, please. 7 years ago, ASCD, which is the leading global educational organization and has over 140,000 members, launched its Whole Child initiative. And so when we look at the education piece, there was a really good model of looking at the whole person, supporting the whole person within the school system. And so that was one model that was out there. Next slide, please. At the same time, the Center for Disease Control was looking at school health and supports for students using the coordinated school health model. And so you had two very different types of agencies working towards the same goal. And so efforts to improve interdependent education, health, and social outcomes were really being done by both of these organizations. Next slide, please. So in 2014, both the ASCD and the Center for Disease Control went past the traditional model and launched the whole child approach. And if you notice this slide, what's in the center is the student. And so you see those same words, healthy, safe, engaged, supported, and challenged, as the focus of the student. In the next ring, you see the coordination of policy, process, and practice, which improves learning and improving health. The outer ring, you see, embraces that whole model. In other words, the community is really important in the whole child approach. Next slide, please. So we get back to that center circle, and when we promote the health and well-being of students and staff within classrooms and schools, we're developing an environment which is the most conducive for effective teaching and learning. And so we know that there's a direct link between health and academics. And so the first part of this is to really know who the students are. By focusing on the student and the whole child, we have a better understanding of what makes the students tick and how we can adjust learning methodologies and offer outside supports to help make it happen for that student. Next slide, please. There is a greater emphasis in the new model around social and emotional climate and around the physical environment, as well as family engagement and community involvement. So you have the original 8 components, but then what happened is they broke out and looked at the social and emotional climate as well as the physical environment. And then they separated out family engagement and community involvement. Those used to be all together, but there's really an important message in looking at the difference between family engagement and community involvement. One involves the intimate core family, and the other involves the community supports, as well as the physical environment. Do students feel physically safe, but also the social and emotional climate? Do they feel emotionally safe to be who they are in the school setting? Next slide, please. This actually, I had one more slide, but it did not come up. But let me just kind of talk before we get on to the next part of our presenters. I think this is one thing that we're looking at is how do we get out of our silos and begin to see the whole child as what we're focusing on, utilizing the whole community as well as the whole school approach. And so when we were putting together this webinar, one of the things we really wanted to find was we wanted to find a school district who'd actually use the whole school, whole community, whole child model in order to put together supports for students. And so we are fortunate today to have two presenters who have actually utilized the whole school model, a whole school, whole child, whole school, whole community, whole child model in order to assist their students. And so I'm going to turn it over to Brandy Bowlen and Lori Combe from the Klein ISD.
Good morning. Thank you, Anita. This is Lori Combe, and we're so pleased to be able to tell the story of Klein ISD and the whole school, whole community, whole child model. We hope that today we can help the participants in this call see how we utilize the components of this model, and that we can help them see vision to operationalize the WISC model in their school community. A little bit about Klein ISD. We're located in northwest suburban Houston and have approximately 50,000 students in 47 schools. In Klein, we're very fortunate to have a full-time registered nurse on every school, and that nurse is supported by their own clerical assistant. Brandy Bowlen is the school nurse at Epps Island Elementary, a Title I campus. Brandy, can you tell us about the campus you serve?
Good morning. Thank you, Lori. Yes, Epps Island Elementary is a kindergarten through fifth grade campus. As you had mentioned, on the north side of Houston. We have 720 students currently and 100 plus employees. 90% of our students are economically disadvantaged, and we have a very high percentage of overweight and obese students. And so as a nurse, I take a personal interest in almost all segments of the model from a wellness perspective, and then I can't wait to tell you all about it.
Great, Brandy. So Anita, just as you said, once upon a time, we were all working in our little silos, and we were pretty happy, so we thought we were doing great things for children in Klein ISD. So health services did its thing, and then nutrition and food services did its thing, and on through our different departments. We were serving children, but we were doing that in a fragmented way. Next slide, please. Next, yeah, thank you. So in 2003, Texas mandated screening for acanthosis nigricans. It's now called the Texas Risk Assessment for Type 2 Diabetes in Children. And we were looking for skin marker. You can see that brown velvety looking skin marker on the hands of this individual in the slide. And we did a BMI and a blood pressure. And then if the children had a skin marker, we were mandated to refer them to a physician. And we had a significant number of students that we were referring, but we weren't really getting any results. We had a poor initial response from the medical community, I think because like us in school nursing, they weren't really aware of acanthosis as being a skin marker sign of excess insulin in the blood, and so they needed education as well. Sometimes our families received orders to change diet and improve exercise, but they didn't really know how to put that into action. And so we saw this as an opportunity for school nurses to become those community health educators, both by sharing information with medical homes and educating families. Next slide, please. We applied to and were granted funding from the Klein Education Foundation. And we realized that one of the campuses we used is Brandy's campus. It was before she arrived to serve those students. But we needed to do culturally relevant family education, as she mentioned, a very large Hispanic community. So we identified about 30 children, and we provided them with once a week nutrition instruction, a physical activity, and a healthy food snack. And this was an after-school activity. We tried to introduce them to foods that they might not normally see in their homes. And that presented opportunities and challenges. We did get the support of nutrition and food services. They helped provide us with some of the food. They helped to provide some of the education. They helped staff our family night that we ran, where we brought all the families together for a family meal, and parents learned how to cook foods that were familiar to them in a healthy way. So we had parent engagement. We had some pieces of the WISC model, but what we discovered is that it's really hard to sustain when all the components are not engaged in your process. So I'm going to turn it over to Brandy so she can tell you how she solved the problem of fragmented pieces. Next slide, please.
Okay, so we're back to the model again, and I just want this slide to be here so that you all can pay close attention to the fact that in the blue segment, there are 10 components. And so, of course, next slide, please. We're going to break it down into pieces so that I can explain to you some things on an elementary, especially campus, are already pretty much provided for you depending on the district. And so here are the pieces of the puzzle that are pretty much in place on our campus. So you have to check off each piece. We had counseling, psychological, and social services already in place with an amazing team. Then our students are offered 135 minutes of physical activity per child per week, as well as daily recess. We have an amazing nutritional environment and district food services supports, and so we offer all kinds of amazing and evolving meals with whole grains and fresh veggie bar, etc. We have a healthy social and emotional climate, and of course a lot of that goes along with the child being supported in those departments. They know they can come here to talk. They know they can have the counselor. Also, the parents know there's an open door. And we'll get to parent involvement again soon. So can we improve any of these to support this student further? And then you have to ask yourself, what can I do to help? And then what goals do I have for each student to become successful and fully supported? And so for me, those 5 pieces were pretty much set in place already. Next slide, please. So then you look at what can I directly impact. And so for me as a school nurse, I began to look at the model after routine health screenings for height and weight revealed an extremely high percentage of obese and overweight students. So I recognize that this directly impacts their education, as the students are at risk for so many things: low self-confidence, bullying, withdrawal, eating disorders, and just countless medical problems. All of these lead to missed instructional hours. Of course, that's what we're all here for. And so the goal was help to decrease the number of overweight and obese students, and then also prevent further students from becoming such. So how do we do that? Well, of course, again, here we offer healthy breakfast and lunch options for every student, as well as physical activity every day. The chance for change is in the family. So in pre-K, we started a program with the pre-K students and their parents after an NASN scope training and then a grant award. So I knew the parents must be involved in order to have any impact. By the model, we also knew that the staff wellness must become a priority. So you can see employee wellness. Well, what does that have to do with the student? It has everything to do with the student. If the staff is well, they're engaged, they're happy, the child has a much better chance of success with a well employee. So you have to look at all the pieces. So we got involved with the Klein program, which Klein ISD offers here, and they have programs for wellness such as Biggest Loser and Maintain Don't Gain, as well as healthy sleep habits and healthy eating habits, just tons of things to offer employees. But we wanted to know then what could we do on our campus with our specific issues. So we began to walk together on campus. We did Zumba on campus after school. Then the staff began a running group, which started with 5 and currently has 15 staff and has spread to several different district campuses. So parents began to notice and participate. So this made a huge impact and started parent engagement, and we'll get to that again in the next slide. So we began participating in the Girls on the Run program. This is an international program for girls in grades 3 through 5, and it promotes self-confidence, physical activity, a healthy diet, strong self-image, and coaches volunteer their time. The coaches in our first season were 8 coaches from our staff of 100 who volunteered. We had 45 girls in grades 3 through 5. So what an impact reaching the whole child. The teacher feedback was out of this world. The parent feedback also absolutely phenomenal. We heard responses like, she wasn't engaged, now she's not afraid to be in a group, she participates, she cannot wait to come to school. And these are things we all want to hear in education. So please realize that school nurses offer such a unique perspective. We have the ability to see every child on campus from all angles. We can bridge the gap between the medical community and the educational community, which sometimes is a little blurry, and we're trained to consider the whole biopsychosocial being. School nurses, without the demands of teachers, administrators, counselors, and parents, have such a unique perspective and the ability to see every single child on campus from all angles. So, next slide, please. So I want to talk about the big hug, is what I call this. So you'll notice on the outside of the model, it says community, and it wraps all the way around the whole model. There are 2 pieces in the blue section, community involvement and family engagement. They are absolutely paramount, and sometimes they're the most difficult to achieve. So please notice, it surrounds the model, and if the student has full community support, they have everything to foster the background for an outstanding educational experience. The student must be safe, engaged, supported, healthy, and challenged, and so sometimes we need help. As you can see from the community involvement photo, our yearly Health and Fitness Community Day has community involvement from parents, community partners, and this is just to name a few: vision centers, dental offices, of course, parents, staff members, probably 40, 45 staff members. All of these components come together to put one day that the students look forward to, now going on our 6th year. The family engagement piece is also extremely important. If the family is engaged in the education of a child in any fashion at all, the child has solid ground to start and sustain, please note, sustain their educational experience. And so, to put it all together for you, several years ago, I wrote a grant from the Oliver Foundation. The grant was funded, and our first team of Girls on the Run were fully supported. The Oliver Foundation, attended our Health and Fitness Community Day. They continued to support our school financially and with products and educational materials, you name it. Sandy from the Oliver Foundation recommended that I check into the Kinesthetic Classroom Collaborative, and I did. I attended and brought back valuable information and shared it with my team, and of course you cannot do any of this without a team. So the Klein Education Foundation awarded our campus a grant for $25,000 for pedal desk classrooms. We began our own action-based learning classroom for kinder and first grade, and all because of one grant opportunity with the Oliver Foundation. So I hope that you can see it comes full circle. This supported Girls on the Run, supported a classroom for 4th grade, supported a 1st and 2nd classroom. And these are all things that started with one, but were not directly related in the end. And I hope that makes perfect sense and that you can use these pieces to think, on my campus, then what can I do to get all of that community involvement and family engagement? Next slide, please.
So what I want to show you here is we started with that acanthosis screening in 2003 and had an intervention in 2007, and our Kleinwell Employee Wellness Program was introduced in 2008, and Brandy got a grant in 2011 And in 2013, we finally started to see obesity rates decline. So the message is change takes time, and you have to learn from your experiences as you go along, and to be flexible in what your goals are and in how you plan to meet those goals. Some efforts may fail, but you have to be patient. Incremental progress is sometimes difficult to acknowledge as success, but you learn something every step of the way. You just have to keep your goal in view. Next slide, please. I want to remind you that whenever you start out with a project, you really need to start with the data first. The data drives your program goals. It helps you identify where your areas of needs are and what direction you want to move forward in. And it also helps you to measure your program success. But you might say, well, but why is that so important? It's because your stakeholders love data. It's the evidence that reveals your success and your failure and encourages them to be your partner. When Brandy's out looking for grant funding, you can be sure she's bringing data to them about the number of people who attend Community Day or about the obesity decrease on her campus that needs sustained funding. So always go to your data. Next slide, please. In my role as the Health Services Coordinator for Klein ISD, it's my responsibility to bring forth policy, process, and practices that improve student learning and health. We look to the evidence and we present it to our school administration and other stakeholders in order to effect positive change. So I encourage you, don't be afraid to step out and be a health champion. For our part, in Klein ISD, we found that school nurses make great health champions, and we believe that access to a school nurse is crucial to student success. School nurses manage population health, chronic diseases, and health emergency response. School nurses have been shown to improve student attendance and to save school administrator and staff time. We realize that not every school district has a school nurse. So who's going to be your health champion? Over time, Klein ISD has learned that school health is more than just a model, but that the pieces are inextricably linked. And for one piece of the process to be successful, the other pieces must be in harmony and must share this common goal of healthy, safe, energized, supported, and challenged learners who grow to be successful adults. Next slide. In summary, I want you to remember that the reason for being in education is to educate a child to the full extent of their potential. How do we do this? By making sure they have the full support of a school community that lives by the WISC model. This supports every aspect of every need that a child can have. With your help, each and every student on each and every campus is the center of the whole child universe and has the big hug of support, as Brandy calls it, from their community. If you need more information about how Klein ISD deploys the WISC model, you can contact Brandy and I at our email addresses as shown on this slide. Thank you.
Thank you both, Brandy and Lori, for being with us this morning. I have a couple of questions. One, what type of or what do obesity reductions look like? You said that y'all had some decreases in obesity rates. Is it in certain grades or is it in general?
Brandy, do you want to speak to that?
Yes, I do. So our initial data started with that pre-K class of that initial grant, and followed them through, and we checked again when they were in second grade. So the program started in pre-K with our initial data and then ended when they were in second grade, and there was a decrease, and it was remarkable. And unfortunately, I don't have it in front of me right this minute, but I can tell you out of 90, maybe it was 98 students, we got 8 out of obese and overweight.
That's awesome.
And if you ask me, that's amazing. Amazing, amazing.
How does your School Health Advisory Council support the work at the schools around the whole child model?
Well, the SHAC has representatives from all of the areas, all of the school district areas on the model. And we have parents, we have counseling, we have employee wellness. And so we meet and we talk about strategies to address wellness on our campuses, and we look at the successes we have on one campus and try to share that information with other campuses so they can deploy those effective interventions as well.
Okay. How did you get the community members engaged in your work?
On the Epsilon campus in particular?
I get, yeah. I think so.
So essentially, it started with our Health and Fitness Community Day. So I invited out, you name it, as I said earlier, a local dentist, the vision center inside our local Walmart, the just different, all kinds of different people. Considering also our community, to me, is the parents, the families, the grandparents, the older siblings. So we had bouncy houses, we had games, and each grade level would put together an activity. So if you hula hoop, you can get stickers. We teamed up with Texas Women's University. The nursing students at their college came out and did presentations and did blood pressures and height and weight and BMI for the parents, for the kids, for anybody who had any questions. And then we gave away pedometers. We talked about counting your steps. We talked about, and this was 6 years ago. So this was kind of, and for our community, these were all eye-opening things. How to read a label, what are healthy snack choices, how do you even know what is a calorie? We just did all kinds of things, and it looked at all of the different things that they could need. So I invited everyone out. Well, over time, the community has started to call me. Hey, I'm from so-and-so church, and we do after-school activities. Can we come to your Health and Fitness Community Day? We hear it's in April. And so now I have them coming to me to ask, and they partner with me year-round. What else can I do for you? How can I support your programs at school? What are you doing at school? It just built a lasting relationship with so many that I couldn't even tell you. But that's exactly how it starts. Invite them out.
Okay.
Melissa, I've pulled up our obesity data, if you'd like me to be more specific about that.
Sure, go ahead.
Great. So we have data from 2011 and then 2013. And what we noticed over that 2-year period, as we think as a result of Brandy's interventions, is that the obesity rate decreased by about 5%. We were just at about 29% obese in 2011 and down to 24%. Now, when that happened, in 2013, our overweight percentage actually increased by about 2%. But we have to remember we have children moving from obesity to overweight. So that means that they've lost weight. They're just in a different category. But most significantly to us, our percentage of students with normal weight in 2011 was about 49%, And by 2013, that had increased to 51%. And so that's 2 years of progress, and the percentages aren't huge, but they're in the right direction.
Okay, that's helpful. Thank you. Studies show that connecting kids to nature improves health. What are you doing in Klein ISD as part of your health program to get your children out in nature? Do you know about the initiative in Houston to get our Title I fourth graders out to public lands?
I am aware that Houston ISD has, I believe it's an overnight camp up in Huntsville. So yes, I do have awareness of that. I would say that that might be a piece that we are missing. I know that we do some field trips to historical farm in our area, but I'm not sure that that's the same as the value of nature in supporting children's health. There's always room to grow.
And I can mention that I know in November, the webinar that we're going to be doing in November is going to explore that very topic. So if you're interested in how you might get children outdoors and successful outdoor programs, please join our webinar in November. Okay, this person says, I'm motivated to get this going at my school, but definitely need a team. Our elementary school needs this. I'm struggling with getting healthy options in our school. I'm on PTA for fundraising. I've suggested active type things for spirit night, but food is winning. Pop-Tarts are on the breakfast menu. My question is, where do I start? School nurse?
Well, if you have a school nurse, go ahead, Brandy, you talk.
Okay, I was going to say, well, for me, that's just something that has to end up, is that a campus thing that Pop-Tarts are what's happening there, or is that a district thing? So you have to find out, where does that problem originate. If it's a campus thing, keep talking. Show evidence, show data, talk about what that does to your blood sugar and how you just will crash and the student will only last you in good thought for X number of hours based on that. We would be more than happy to help you with that. It is a big deal. Breakfast is a big deal, or snacks are a big deal. But definitely get it going. Don't let it fall through. I realize that sometimes we have to give and take. So if the Pop-Tarts mean you get to have a seminar on healthy eating, well, then give and take. Start very small. We learned that you must start small. Sometimes it's very difficult to change everything all at once. So if you can focus on anything or get your foot in the door anywhere, then grow from there, and then grow from there. It could take years, but you just have to start. So if Pop-Tarts win, but you end up with the ability to be able to start something, then go with it anyway and fight it down the line.
And I would say from a district level that you would want to look at your school district wellness policy to provide guidance about nutritional options. And then the other piece we leverage is in Texas, we have guidelines for the care of students at risk for anaphylaxis related to food allergy. And so we have very strongly stated in there that we discourage the instructional use of food and the use of food for reward. So you might look to those two policy sets for guidance and assistance and support.
And something you can do to get things moving on your campus is maybe do a survey. You can do a free survey on something called SurveyMonkey and ask your parents how they feel about some of the issues that you're seeing. And if you get the support of additional parents, it's a lot easier to get things going. And then you can also visit with your campus improvement council or site-based group. I'm not sure, they're called different things, but there's a group on each campus that's responsible for looking at policies and programs for the campus, and try to get involved with that and make sure that they have a focus on health. And then get a team. You should have a coordinated school health program on your campus. That's mandated by the state. So those are some of the things that you need to think about that might help you. Um, Jennifer Bristol mentioned that the initiative that was brought up earlier is part of the Every Kid in a Park program, and it's supported by the National Park Service, and they have over 15 partners in Houston. And then there's information on Region 4, which I will add into the email that we send out after this. Also, Jennifer mentioned it is Childhood Obesity Awareness Month. So this is a great time for us to be looking at these items. Here's another question. I need to ask if there is a health team. Thank you. Okay, that's true. Yes, each campus should have some type of wellness team that's working on implementing coordinated school health. And as Anita mentioned, coordinated school health is part of this whole child model. So one of the state mandates is that in your campus improvement plan, it shows how you're implementing coordinated school health. And that's an easy intro to getting some things started on your campus. But I truly believe it's best if you get some additional parents in line with you, find other parents who are worried about maybe recess is a problem, or like you said, the food fundraisers on campus. Find a common issue that parents really will support, and then go in and talk to your principal and start trying to work on some of the issues. Anita, anyone else, do you have anything else to add?
Yes, Michelle, what I'd like to add is we are in the process of updating our School Health Advisory Council guide. And so one of the things we've done to update it is to put in any legislation that was passed within this last session or two. But then also we have included the WISC model into this guide. So if we're anticipating we'll probably have it completed by the end of October to where it'll be downloadable. We've got a lot of tools and resources incorporated into the guide, some of which were developed by the Texas School Health Advisory Committee. And so we will try to get word out as far as we can as soon as this is ready. But we did incorporate the WISC model into this this revised publication.
So any other questions out there? It looks like I've come to the end of them. I think this has been very helpful. It's always great to hear from schools and school districts that are being successful. I think that's one of the things that helps all of our school districts get things moving. I know that I've talked to a couple of people this week that are working on recess, and the Dallas recess policy helped Austin work on recess, and now we've passed a recess policy. And it just, the more of this focus on the whole child and focus on nutrition and physical activity we can get and share, the more likely it is that we'll be able to continue to build and grow on these. So Brandy and Lori, do you have any parting words for our attendees?
I think that this is Lori, and I think that you just need to take the chance, and you need to find a colleague who's willing to take that chance with you, and always keep students at the forefront of your efforts. Brandy?
Yes, ma'am. I just would like to throw out there for you guys that if you become a model on your campus, people will follow you. You can get the staff to follow you, you can get the kids to follow you, you can eventually get the parents in the community to follow you. So if you start walking, you start a class, you start eating healthy and showing people, then you can make change in an entire community and affect 720 students just by starting something yourself. Something very small that to you may be nothing at all can end up changing an entire generation. And so I would just encourage you, start small, start something, but get started.
That's it.
And Michelle, I would say too, if you've got a positive example, let all of us know, because we really like to promote the work of school districts who have been successful. And sometimes what you think is just everyday occurrence actually is something that could really be shared through a webinar, through a write-up, in the Friday Beat or other publications. So if you're out there and you're doing this type of work, we encourage you to share it, because I think that's where the learning takes place. What works for one district may need to be just a little bit tweaked for another. But we need the success stories. We need to hear from folks as what they're doing that's been successful, because it really does help us to pass it along to others.
Thanks, Anita. Yeah, I was reminded the other day, it's like somebody said, how do you eat an elephant? One bite at a time. So you can't do it all at once. Find out what's most important to your school or your district and focus there, and then as everybody has mentioned, it grows from there, one thing at a time, and you truly will make a difference. Well, please keep on the Action for Healthy Kids email list, and you will get a newsletter monthly that will let you know we have School Health Advisory Council webinars coming up. We have more webinars with our partners from Department of State Health Services and Department of Agriculture and TEA. So lots of good information for you. And as Anita mentioned, if you have information you think would be helpful, please share with us, and maybe we'll add you to one of our future webinars. Have a great week, and happy Childhood Obesity Awareness Month.